At Cumberland Manor, where 9 elderly residents died from COVID last year, workers are doing their best to get things back to normal, with daily entertainment and a weekly happy hour. It's been difficult recovering from the trauma of 2020, and the vaccine rollout is proving to be another ordeal. These residents are still waiting for their initial Pfizer jabs.
Because we were the most hit, we were the vulnerable ones, and I would think that we're first on queue.
Just sort of seems funny that people that haven't been in the front line and in with all the COVID seem to be getting a needle or getting their vaccinations and everything else, and the ones that have been here working their butt off day in, day out within the COVID, you still got to wait.
It is very frustrating for them because they thought that they were forgotten.
Nearly 130,000 doses have been administered to residents in aged and disability care so far, according to the most recent statistics from the Department of Health, and more than 74,000 second doses.
The priority populations in 1A, they are absolutely important, and we do need to lift our game, I think particularly on people with disability. We're making steady, but probably not quite fast enough progress with aged care, but at least we're getting steady progress.
The vaccine rollout is being ramped up for others. From next week, all people over 50 will be eligible for their first AstraZeneca jab.
I've got a number of friends that are, what I'd say, on the fence. I've got some that are basically not going to do it at all. And everyone's entitled to their opinion. Personally, I have no issue with actually taking it myself, irrespective of which brand it is.
Robert McNeil will get the vaccine so he can travel overseas, but his wife isn't so sure what she'll do.
The COVID vaccine, I'm a little apprehensive. I've heard a lot of information, but the problem is you're getting one lot of information from one set of people and a different lot of information from another lot of people, and they don't match up.
Today, the Health Minister tried to reassure people worried about AstraZeneca causing blood clots.
Following the medical advice has kept Australia safe. Following the medical advice, coming forward for vaccinating as early as you can, when it's your time, will protect you, but it can also protect every Australian.
While the discussion continues among those who'll soon be eligible, the disability care sector is also frustrated by delays.
Do you want the drink? No? Okay, well, Mummy, put it there then.
My son's Raymond. He's 45. He caught meningitis, ended up profoundly disabled. He now has, good boy, darling, he's non-verbal, he has hemiplegia and epilepsy.
Margaret Ruff thought her son would be vaccinated in February when the rollout started, but he wasn't, nor were the 4 other disabled residents he lives with.
Can you see the dog? What country gives their politicians injections and people with disability and the staff looking after them still haven't had them?
Federal health authorities have conceded the rollout in the disability sector was behind schedule.
So 8 weeks in, 6.5% of disability residents have had
I've said several times, Senator, we acknowledge it's a very small portion and we're ready to ramp up.
The risk of severe illness and death is significantly greater in the residential aged care population. The complexity of aged care meant that we had to prioritise to get that group protected at the same time as trying to get disability started. The plan is to get all of the vulnerable people in phase 1 done by the middle of the year, but that doesn't mean that disability in 1A is not a high priority.
I would like to see everyone in a disability home, including the staff, treated with respect and vaccinated as soon as possible.
In a statement to 7:30, the government said it was committed to giving a safe and effective vaccine to people in the Group 1A, adding it was a complex logistical operation.
Somebody with a disability is more likely than somebody at the same age to die, but they're not going to be as old on average. So it's all about averages and trying to get your vaccine to where it's going to have the biggest effect. So aged care before disability, yes, was the right decision.
Meanwhile, the frontline workers are doing what they've been doing for more than a year in care homes around the country, looking after the community's most vulnerable, and hoping vaccination schedules will be met in the next couple of weeks.
We reassure them. I'm pretty sure they will come for us. That's the best we can say to them. They trust us, so they are reassured.
The future's not ours to see.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.